Traditional ways of knowing and healing can be part of both cancer screening and cancer treatment. So for example, if people are nervous before going for a screening test, they can always make contact with an elder or a knowledge keeper, or participate in some sort of ceremony to ground themselves, to center themselves before undergoing a potentially, anxiety-provoking or even uncomfortable procedure. And I think as part of cancer treatment, we are working at First Nations Health Authority and with other partners to make traditional healing ceremony and culture very much a part of that treatment that's available. So for example, having elders available in various clinics, having Aboriginal patient navigators to help people wend their way through the system.
I agree, and just like the traditional healing ceremony, our culture is part of our wellness. And what I like to share with the patients that are in my office as a cancer surgeon is that I think we're so lucky. We have not only the cancer treatments and the cancer tests and the screening programs that every British Columbian has, but we have this whole other arsenal of tools that we have to find that path of wellness and to carry with us. You don't have to choose one or the other. We have it all. It's such a powerful place to be, really. But there are also a lot of resources. The First Nations Health Authority is a great place to start, but also within the health authorities, there's the patient navigators that can answer questions about where do you go, when do you go. The Cancer Agency itself in BC has Indigenous patient navigators that have just started because of the support and the advocacy by the First Nations Health Authority. There's other resources that you can ask for. And of course, it's going back to what we often talk about, elders and knowledge keepers, and those in our community that have been on this journey and beat it.
I think it's important for all of us as community members to check in with people and see how they're doing, because sometimes when you're distressed, it's hard to reach out for help. But there are supports available. And again, I think both of us would direct you to the FNHA website at fnha.ca/cancer.